Maybe let's walk through that on the drug approval process, if you don't mind, because I know it's federal jurisdiction and provincial items, and then although something is approved and fast tracked, sometimes in the States we lag behind. Maybe you can walk us through that a bit.
Yeah, absolutely. It's pretty complicated. We have, as Mr. Getson mentioned, the federal and then the provincial jurisdiction. So federal's like Health Canada, they approve it as being safe, and then there's a cost benefit analysis that's done. So those are both expected to be done at the end of June. And usually they'd be done one after the other, and it could take up to 1.5 years to get that all finished. But the health minister at the federal level recognized how important Trikafta was and gave it an aligned review, which means those things are being done together, and an expedited priority review, which means they're done in 6 months and not 1 year to 1.5 years. So we're really hoping that once that gets done in June, it moves to the provincial level, and then all the provinces kind of work together to negotiate a price that they're good with in order to add it to a public plan, and then everybody will hopefully be able to get it. But there's no timeline set for that, and there's other drugs like Orkambi that I mentioned earlier, and another one called Kalydeco that have kind of been tied up in that process for quite a few years. Specifically Orkambi since last June, and Kalydeco has been Health Canada approved since 2012, I believe, or 2014. Alberta is one of the 3 provinces that does fund Kalydeco, which helps 6% of people with CF, to the extent that it is Health Canada approved. For everything that Health Canada has approved it for, Alberta funds and provides, which is amazing. So we're hoping that we can also be the leader on Trikafta, which is the drug that helps 90%. So the vast, vast majority of people with CF, similar to the way that Kalydeco has helped the few.
Well, you've already got me convinced on this one, and Minister Shandro, I hate to say it, he gets painted as kind of the bad guy all the time, but working with his department and having access to him, I think you can agree with me. You've talked to him, their group as well. They're very responsive.
Yeah.
Yeah.
We've had meetings with the Alberta Health Ministry over the last year, and they have been very receptive to keeping the door open and keeping conversations going. And our hope is that as soon as it's Health Canada approved and lands in their lap, that the groundwork is already done to get it to patients as soon as possible. Yeah.
Well, you've got my support on it for sure.
Thank you.
We mentioned to the Royal Caucus as well, much of my colleagues they're on board. And again, with us, it's obviously the portion of the population that needs it is it's not vast, but it's critical. Yeah. And the fact that you can have such dramatic results in such a short time frame, and I'm with you. If we can derail this before a bunch of folks get too sick or have to go through, heaven forbid, somebody else that has a chance that doesn't have to go through what you did at your stage, we can give that many more years and productive years.
Absolutely. I do know of 3 families, actually, not all just from Alberta, excuse me, that are sadly actively planning to leave Canada if they can't get the drug that they need for their kids. And I mean, we'll do anything for our children, right?
Absolutely.
And the thing is we pride ourselves on being a country that has great healthcare. And it's really sad to think that there are people that want to leave here for Europe and the US and the UK, where they're funded publicly. A number of countries in those areas are funded publicly for this drug, and their kids are thriving on social media anecdotally. Like the symptoms are virtually gone for a lot of them. So yeah, we really, really are hoping that this happens quickly.
Well, you have my word that I'll push as much as I can from my end. Thank you so much for taking the time.